All right, today we're decoding a really critical message your body can send, but it's one that's often totally misunderstood. I'm talking about an enlarged liver, or, the medical term hepatomegaly. We're going to find out what it really means when this happens. So, what if your body had a warning system, but instead of a blaring siren, it was more like a quiet internal signal? Well, an enlarged liver is pretty much exactly that. It's like this silent alarm telling you, hey, something deeper is going on here. So let's dive in and figure out what that signal is all about.
Okay, so first things first, what even is hepatomegaly? Let's break down this huge clinical clue.
The name itself gives us a pretty good hint. It comes straight from Greek words for large liver. But here's the absolute key thing to get. Hepatomegaly isn't actually a disease in and of itself. Nope, it's a physical sign, a really clear marker that some other underlying health issue needs a closer look. Honestly, this is the perfect way to wrap your head around it. I mean, think about it. When your car's check engine light flips on, you don't just, put a piece of tape over it, right? No, you find out why it's on. And it's the exact same idea with your liver. The enlargement is the signal that it's time to pop the hood and see what's really going on. All right, so if an enlarged liver is the clue, who are the usual suspects? What are the potential culprits here? Well, the list is surprisingly long. It really does turn the whole diagnostic process into a bit of medical detective work. And honestly, the sheer number of possible causes is just staggering. It could be something infectious, right? Like viral hepatitis or even dengue fever. Or it could be a vascular issue. For example, with congestive heart failure, the heart just can't pump blood the way it's supposed to. So it backs up and literally swells the liver. And then sometimes it's just a simple plumbing problem, like a gallstone blocking up a bile duct. This massive range of possibilities is exactly why a doctor can't just take one look and know what's wrong. There was this really fascinating study from a teaching hospital in Lucknow, India, that broke all these causes down into two main buckets, infective and non-infective. And they found it was pretty much a 50-50 split. They even spotted a seasonal trend. Infections would spike during the rainy season. But, and this is where it gets interesting, it's inside that non-infective group where a really surprising modern story starts to pop up. So yeah, we all know about things like infections and heart failure as potential causes. But this study from Lucknow, it shined a big spotlight on a totally different condition that is just rapidly climbing the charts. Okay, just take a look at this. The number one single most common cause of an enlarged liver in their study at 21% was non-alcoholic fatty liver disease. We'll just call it NAFLD. I mean, it beat out congestive heart failure. It beat out common infections like dengue. This is a huge deal. The researchers themselves basically said, hey, non-alcoholic fatty liver disease has emerged as a really important cause here. So what is it exactly? And why is it suddenly becoming so common?
Well, basically, NAFLD is the liver's part of a much bigger picture called metabolic syndrome. And that is tied directly to our modern lifestyle issues, things like obesity, high blood pressure, and high blood sugar. And that's why its rise as a cause for an enlarged liver is such a massive public health signal.
Okay, so we know the signal, and we know some of the big potential causes. But how do doctors actually connect the dots and solve this mystery? Well, they follow a really systematic path. It all starts with a physical exam, where a doctor actually feels for the liver's edge. Then comes the blood work to check for any inflammation, infection, or metabolic red flags. But the real key first step to actually see what's going on, that's imaging. And it usually kicks off with a simple ultrasound. And you can think of this flowchart as the doctor's roadmap, or maybe like their GPS. Based on whatever that first ultrasound turns up, maybe it's a dilated bile duct, maybe it's an unusual texture, they have a clear path forward. It tells them, okay, do we need to investigate a blockage? Or should we look deeper for signs of cirrhosis? Or do we maybe even need to do a biopsy to get the final answer? All right, let's bring this all home. What's the big takeaway here? Why does this one particular sign matter so much? It really all comes back to that check engine light idea, doesn't it? An enlarged liver is your body telling you something's up. And ignoring it, well, that doesn't make the problem magically disappear. It just delays the chance to actually get in there and fix it. So, here's the bottom line. First, hepatomegaly isn't the disease, it's a super important clue. Second, the big twist here is that lifestyle-related stuff like NAFLD is now a leading cause. The course of action is clear. Doctors use a systematic process to find that root cause. And finally, getting it checked out early is, without a doubt, the best way to head off serious complications later on.
And that really leaves us with one final crucial question. Your liver is talking. The real question is, are you listening?
Hey, if you found this breakdown useful, do us a favor and hit that like button, share it, and of course, subscribe. And don't forget to press the bell icon so you don't miss out on our next video. And hey, if you need any physical therapy or emergency pain relief, be sure to visit our clinic. You can find us at dgpc.ueneweb.com. Thanks so much for joining us.